All right, everybody, welcome back. Today we've got kind of a special guest here, Dr. Daniel Klauer. Dr. Klauer and I actually went to dental school together, and since then he has been very, very busy. Dr. Klauer's taken over 2,000 hours of continuing education. He speaks internationally, and he has become a specialist and my go-to guy whenever I have questions on jaw joint disorders or sleep issues, and how dentists have become a part of the solution and a part of the plan in helping people be healthier. So he went to the Ohio State University for dental school, graduated from Notre Dame. I actually played golf there, quite the player. I'm jealous of that. But Dr. Klauer, thanks for taking time for us today.
No, my pleasure. Thanks for having me.
Well, let's get into it. Let's start with the sleep aspect of it. What do you talk to your patients about? How sleep and sleep apnea and everything else can affect your overall health.
So, a big thing that we talk about in our practice is keeping the body healthy. And, the saying is we can go weeks without food, days without water, and just minutes without air. So within a few minutes of not respiring like normal, we can have significant health consequences that start off pretty quick. So for any type of treatment or any disease process, the better we can control inflammation, the less progression we'll have of that. And we know that right close second to breathing is adequate sleep. Every living known organism out there sleeps to some extent, and that's when the body rests, rejuvenates, and heals. So the moment we start to take that away from a patient, we start to take away their ability to heal and recover. So patients, doctors will ask me, well, do you do more of TMJ or do you do more of sleep? And I'm like, well, you can't do one without the other, because anybody that's suffering with a chronic inflammatory disease or pain needs adequate sleep to get better. So inevitably, every single patient I see is a sleep patient because they all sleep. An interesting study, which I didn't do, but they have done on rats, is they keep these rats awake. And after so long, they start to develop tumors. They start to gain weight even though they don't have food. And what they do is it sounds terrible, but they agitate the cage to keep the rat awake. And eventually, after so many days, unfortunately, the rat just dies. So we do know, and we have documentation, that sleep deprivation does physically kill you because the body doesn't have a chance to heal, rest, and recover. So as doing this solely 100%, I see patients when they're further along down the disease process. So things are usually a little bit worse than when I was just doing general dentistry, and I could pick these things up a little earlier in the process.
Man, as you mentioned, it's a huge part to our overall health. And we had talked to someone recently who said, if you want to be able to fight a disease better or any infection, you've got to be healthy. You got to be sleeping. That can affect your overall health. And it sounds like.
Yeah. So Mayo Clinic just put out kind of a reminder of how to fight the COVID virus, and the 4 things they discussed, which are really good for overall health, was adequate sleep, and they wrote a article about that. They talked about meditation, so practicing mindfulness and having your brain less stressed of minutia, because that affects our overall health. And they talked about diet, and they talked about exercise as well. And so those 4 things definitely set your body up to be healthier. And we all have been in a situation where we were fighting something, and then we have a wedding, or we're up late for work, or we took a red eye home, or we had some life event that fragmented our sleep, stress went a little higher, and then we caught the cold or we caught the bug, and it really just knocked us down. And we look back, we're like, man, if I hadn't stayed up super late for work, I think I would have not caught that bug. And so that's really what we're trying to do now is, even though a lot of us are having more time, don't stay up late watching Netflix. Don't get out of your routine. Don't stop working out. Try to keep that same structure, because your brain is used to that same structure. And if all of a sudden you start going to bed at crazy hours and you wake up whenever you want, your body's going to adapt to that differently. And especially those individuals that are more at risk. So like I just today told my mom to stop watching the news. It's like, I'll give you any updates you need to know, because I have some trusted resources that they're getting paid to vet this. And then they put together a newsletter, which I pay for, which then gets sent to me to get a summary. So that's where I get my info as to what's going on versus spending hours stressing myself out about reading something that's proven to not be true 5 minutes later.
That's good advice. Now, when someone's at home or kind of analyzing themselves, or they come to the dentist to have these things checked out, what should they be cognizant of? What should they be aware of at home? And what does the general dentist look for to see if maybe sleep is an issue?
So the 3 questions we ask every patient at every single visit is it easy for you to fall asleep? Yes or no? Do you stay asleep? Yes or no? And do you wake rested? And now there's a little more than just those 3 questions. So I would say to you, patient, I'd say, hey, Lee, is it easy for you to fall asleep? Well, yeah, I mean, like after an hour and a half and a Tylenol PM. And it's like, well, no, that's not normal. And then patient would say, well, yeah, it is. That's what I've always done. Okay, well, that doesn't make it normal. It just makes you used to it. And then the next question is, do you stay asleep? Well, yeah, but I mean, I wake up to use the restroom twice, but yeah, otherwise, yeah, I stay asleep. That again is not normal. You know, we're supposed to sleep through the night. Our body produces hormones that retains the urine. So it is abnormal. It is a sign of sleep apnea to wake up and urinate at nighttime. And then the last question being, do you wake rested? Well, no, who wakes rested? No one does. You know, after my 3 cups of coffee, I'm good to go. So we can get so normalized to how we feel that we actually are steering away our provider from helping us. Because if you were to just ask those questions, a patient could say, yeah, I fall asleep. Yeah, I stay asleep. And yeah, I wake rested. Okay, great. But if you ask a second level question, you'll find out that they're falling asleep easy because they take a medication. They actually wake up 4 times a night, but that's normal. So they didn't say anything. And they feel great after 3 cups of coffee in the morning. So as a dentist, what I usually go back to, and this usually resonates with a patient who is in denial of a sleep issue, but not trying to be deceitful. They're not telling us the truth because they've rationalized their behavior. And if you don't rationalize behavior, life's pretty miserable. So anytime you have a symptom, you try to rationalize it. So I'll tell a patient, hey, I suspect you have apnea because this, and that. And they're like, well, I don't think I do. And I said, well, I saw Dr. Brown did a filling. Oh yeah, he did a filling right here. I said, oh, so how bad did it hurt? Oh no, it didn't hurt at all. I'm like, well, why did you do it then? Well, he said he saw in an x-ray, he saw a dark spot, and then he told me that's a cavity and I should fix it so it doesn't get worse. I go, so you completely trusted what he told you was the truth? Well, yeah, I guess. I said, great. So if you feel the same trust with me, your snoring, your morning headaches, your high blood pressure, and your fatigue are probably related to apnea. What can I explain more so you trust that connection? And it usually resonates with the patient better. The other thing I tell a patient is, you go to Dr. Brown because he should be able to pick up a disease process before you'll ever know what's going on. You might tell him a bunch of symptoms, but he should be able to decipher what that means to make a recommendation for your overall health. So if someone comes in with tooth sensitivity or some other dental issue, you should be able to figure that out faster than they can. And so sometimes we do tell patients what they don't know because we have the luxury of studying, training, and kind of seeing it with a different lens.
That's such great intel because, as you know, in medicine and in dentistry, we're constantly learning more and understanding better. You know, the way we treated things medically 10 years ago is very different than what we're doing now. And in dentistry, a lot of people just don't have that connection between sleep issues and what's going on with their oral cavity. So, Doc, this is really, really powerful stuff. We're going to have you back on. We're going to talk a little bit more about jaw joint issues, and hopefully we can help as many people as possible just feel better and get healthy.
Great. Anytime. Thanks for having me.
Thanks, Dan.